The flow meter should be attached to an appropriate oxygen supply. Fill the bottle with sterile water using an aseptic technique and fit the humidifier head or fit a pre-filled sterile water bottle. The humidifier should then be attached to the flow meter. Adjust the flow meter to 4 litres per minute and occlude the outlet. Verify that the relief valve operates within 5 seconds. Reset the oxygen flow meter to the appropriate flow for the patient. Attach the delivery device and fit to the patient. The other method of delivering cold humidification is by using a humidifier nebulizer. Humidifier nebulizers use the Venturi principle to create a low pressure area at the end of a tube. The other end of the tube extends into a bottle containing sterile water. Water is drawn up the tube and is broken into an aerosol of small droplets by the oxygen stream. This same low pressure area also entrains air from the atmosphere to dilute the oxygen to the desired level. The air-oxygen mixture containing the water droplets then passes to the patient. Humidifier nebulizers can deliver between 24 and 50 milligrams of water per litre of gas depending on the flow setting. Humidifier nebulizers are most commonly used with devices such as aerosol and tracheostomy masks. It is important that these devices operate as quietly as possible to ensure a comfortable environment for the patient. They should also conform to international standards to ensure that the oxygen concentrations are delivered accurately. Some devices are fitted with a tamper-proof control to prevent inadvertent changes to oxygen concentrations. As with bubble humidifiers, the head of the nebulizer humidifier may also incorporate a universal screw thread. This permits the use of a bottle which can be refilled with sterile water or the use of pre-filled sterile water bottles. The flow meter should be attached to an appropriate oxygen supply. Fill the bottle with sterile water using an aseptic technique and fit to the humidifier head or fit a pre-filled sterile water bottle. The humidifier nebulizer should then be attached to the flow meter. Attach 22mm flex tube to the outlet of the humidifier nebulizer. Position the tubing so that the lowest point is below the patient. This is to prevent any condensed water from running into the patient. Attach the mask. Adjust the oxygen concentration to the required level. Set the flow meter to provide the required total flow to the patient. The intersurgical aqua mist makes this simple by indicating the appropriate flow above each oxygen setting. Attach the delivery device and fit to the patient. There is no universal standard for flow meter connections, and they can vary by country. The Aquaflow and Aqua Mist both incorporate a DISS oxygen connection, which is the most common type. A number of flow meter adapters are available to fit other types of flow meter. For example, the M12. Caution: these devices should not be used in ventilator circuits, as the air entrainment port will introduce a leak into the system. These devices should only be filled with sterile fluids that are changed every day. Any residual fluid should be drained from the bottle and discarded before refilling. It is important that the lowest point of the flex tube is lower than the patient and that any condensate is regularly drained to prevent this entering the patient or occluding the flex tube. It may be helpful to emphasize some important points regarding oxygen therapy. All critically ill patients require oxygen. Central cyanosis is caused by both cardiac and pulmonary disease. Peripheral cyanosis results from a sluggish peripheral circulation, as in hypovolemia, cardiogenic shock, a cold environment, and arterial or venous obstruction. Hyperventilation and disorders affecting ventilation perfusion matching are the most frequent acute causes of cyanosis seen in acute emergencies. High concentrations of inspired oxygen do not depress ventilation in patients with acute respiratory failure. Oxygen therapy must be prescribed. Oxygen therapy must be monitored. Patients do not die from a raised carbon dioxide level alone. They die from hypoxemia. Pulse oximeters measure oxygenation, not ventilation. Definitions, indications, precautions and possible complications of oxygen therapy. Indications for oxygen therapy include documented hypoxemia. This is defined as decreased PaO2 in the blood below normal range. A PaO2 of less than 60 torr or SaO2 of less than 90% in patients breathing room air, or with a PaO2 and/or SaO2 below the desired range for a specific clinical situation. In an acute care situation in which hypoxemia is suspected, substantiation of hypoxemia is required within an appropriate period of time following the initiation of therapy. Severe trauma, an acute myocardial infarction, short-term therapy or surgical intervention, for example, post-anesthesia recovery. Precautions and possible complications. With a PaO2 greater or equal to 60 torr, ventilatory depression may occur in spontaneously breathing patients with an elevated PaCO2. With FiO2 greater or equal to 0.5, absorption atelectasis, oxygen toxicity, and/or depression of ciliary and/or leukocytic function may occur. The administration of supplemental oxygen to patients with chronic CO2 retention may result in a decrease in respiratory drive. Supplemental oxygen should be administered with caution to patients suffering from paraquat poisoning and to patients receiving bleomycin. During laser bronchoscopy, minimum levels of supplemental oxygen should be used to avoid intratracheal ignition. Fire hazard is increased in the presence of increased oxygen concentrations. Bacterial contamination associated with certain nebulization and humidification systems is a possible hazard. Limitations of procedure. Oxygen therapy has only limited benefit for the treatment of hypoxia due to anemia, and benefit may be limited with ventilatory disturbances. Oxygen therapy should not be used in lieu of, but in addition to, mechanical ventilation when ventilator support is indicated.